Today, my guest is someone I'm very excited to chat with. His name is Randy Hillier. He is an independent MPP in the Lanark, Frontenac, Kingston riding. And essentially, over the last year, he has made a big impact by being very anti-lockdown and kind of trying to make sure Canada doesn't fall into a totalitarian regime. And a lot of people may think it's a bit overblown, but he does explain in this conversation a lot about why he has these views and some of the things that we have to watch out for. So, without further ado, here is my conversation with Randy Hillier.
Everything sounds good.
Yeah, I'm actually very very sick right now, so that's another thing. So you might see me just like sweating uncontrollably, and I apologize for that if
Not
that's
from
the case.
COVID. Not
It
from COVID, I hope.
it is not COVID. I just got tested. I was hoping that it was COVID because then I'd have the antibodies, so I'd be good to go,
Right.
right?
Yeah.
But then and because it was like 2 days of sickness, so but
Yeah. Well, you probably have the antibodies regardless.
yeah.
Yeah.
Why is that?
Well, Dr. Kulvinder Kaur and quite a few other people have done a substantial amount of research on this. And, coronaviruses have been circulating within the human population since either we came out of the garden or came out of the trees, whichever you prefer.
Mm-hmm.
And, we have a substantial amount of immunity to coronaviruses. And you can see that, the people who are at risk from coronaviruses or COVID, whatever you want to call it, are very elderly, very frail, very, people in compromised health positions. That's, and we've, between antibodies and T cells, our immune systems are generally pretty good at combating viruses, unless, of course, you fit into one of those categories where you're not well. So.
Yeah, yeah. And so actually one of the things I saw today was there's certain universities in Canada now that are saying that we aren't able to return back to school unless we have the vaccine, which I think is starting to get pretty worrying.
Listen, it's not starting to get pretty worrying. For me, it started to get pretty worrying in near the middle to end of April last year, when it was clear, when the evidence was and the data was showing that the projections and the models were outlandishly wrong, and the evidence was coming in that this was appearing more and more like a seasonal respiratory virus that we experience, every year. But we continued to take a very totalitarian approach, a political approach to what was being conveyed as a health crisis, but it was everything that we were doing was a political approach. So that's when it became evident to me that there was much more at play here than a virus.
Yeah, and what do you think now? Doug Ford recently passed laws pretty much making it a police state, and then there was more of a police state where police are able to stop you and find out why you're out of your house, and then all the police pretty much gathered together and said we're not going to be enforcing that, and then they've had to dial it back.
I missed some of the audio there. I lost it, but I think what you're getting at is, we've used diplomatic language and used the term lockdown for 13 months now. But as we can see, that's a disingenuous term. When you have your borders sealed off with armed police officers and you cannot go to other provinces, when your national border is blocked off and you cannot travel freely to other countries, that's a hallmark of a totalitarian state. When people are fearful of being stopped by the police or having friends or family over in their house because somebody may snitch on them and the police may arrive. These are those measures historically are indicators of martial law, not lockdowns. Okay, that's what
Hmm.
historically we've called that. When people cannot, when you need to have the state's permission to travel, that's not a free society. So, I'm thankful that a number of police services finally said after 13 months, enough is enough, and we're not going to go this next step. Um, and I appreciate that. And we saw that Doug Ford had to backtrack somewhat on on his measures as a result. But in practice, we're still seeing many police, engaging in these martial law practices. Um, there was an encounter last night. It's not been made available on the media yet, but where um, police officers arrived in a church parking lot in Ontario and confronted and demanded identity and um, and information about these people who were in a church parking lot last night. Thankfully, some of the people who were in that parking lot were also active duty police officers, but not in uniform. And their assertion of their freedoms drove those uniform cops away. So, although there's some good signs, in practice, we're still seeing some very authoritarian approaches by authorities here in Ontario.
Hmm. Yeah, I was just thinking about it in terms of sort of now it seems like the balance has shifted a little bit. So before it was just like everything's going ahead, no problem as planned. But now that they've been able to say like, no, we're not going any further than that. Why are you doing this? You know, it looked like Doug Ford just kept trying to do more, like take more rights away, just like seeing what he could get away with. And then now that they were able to like say like we're not going to do that, I feel that's going to help people sort of wake up and be like, okay, what else are they kind of not being honest about, or what else do they not have any evidence for, but they're going to instill as a rule.
Yeah, I think the biggest problem all throughout this has been, and this is where I believe the benefit is from last weekend's announcements by the police services. The biggest problem has been people have been fearful of speaking out. People have also been feeling helpless and victimized by our governments and not knowing what they can do, if anything. And the actions by the police services last weekend is instructive in this, in showing people that that's all it requires. When people stand up and speak out and say they oppose, any government with any moral legitimacy must respect that voice. And Ford did. He backpedaled, um, and and that's the first time we've seen that in 13 months in Ontario, where any public institution, whether it be healthcare, education, police, our courts, none of them have ever spoken up and opposed. And all these institutions are there to uphold and protect our way of life and our freedoms. So there is a glimmer of hope there, but on the ground, we still have a lot of police officers who have forgotten or are ignorant of their oath of office, that they are to uphold our Constitution and they're there to protect our freedoms, not to abuse them.
Hmm. And so the reason that they're giving for the lockdown, well, at the beginning it was ventilators. Now they're saying that the healthcare system is being overrun. What do you think about that situation? Is that true? That we're running out of like spots in the ICUs, or are they just kind of making all this up, or?
It's completely untrue. And we know for the last 15 years in Ontario, since I've been in elected office anyway, our hospital systems were always over capacity. Typically, our utilization of hospitals was between 110 and 120% every year. And we coined a term to describe that failure of our healthcare system. The term was hallway healthcare, right? I'm sure you remember hearing that term. And because our hospitals were always over capacity, there was justification in March of 2020 with an unknown virus to do things that would not amplify that crisis. But what we've seen since then is our hospital utilization, even today, is at about 80% capacity. Significantly fewer people are in hospitals today. And that's because of policies, not because it's both because of fear of people that go to hospital. People are fearful of getting medical attention, and also the policies of our healthcare system, which are preventing people from getting needed procedures done. But yeah, our hospital system is not anywhere near. In Ontario, we have about 25,000 beds, and the peak that we've had of people in the hospital with COVID is 1,900.
Mm-hmm.
So it's a far cry from being overwhelmed. Like that's a disingenuous proposition that public health and the Ontario Hospital Association is providing people.
And so it sounds like actually we essentially had similar ideas. So at the beginning, I was very kind of pro lockdown, just because this is something we didn't understand, we didn't know what was going on. But then, as sort of more education kind of came out, I was like, oh, actually, maybe there's different solutions to this situation. For example, like protecting people in long-term care homes, for example, and like even the way that Ontario had it set up is even when we're in yellow or red zones or something like that, you were still able to go visit people in long-term care homes only, but like you just had to pass a temperature check, right? Which is going to help kind of that run rampant. Like no, I don't think anyone's ever been caught with COVID from a temperature check, to be honest. Like I don't think it's ever worked. Like I'm very sick right now. If I were to go into a restaurant right now, I bet I would pass a temperature check.
Right. Well, listen, what we've done in the last 13 months is a complete experiment. It's never been done before. And a lot of people don't realize this, Jeffrey, that, in October of 2019, just months before this pandemic was announced, the WHO published a pandemic planning document. It's about 65 pages in length, and it's available online. Anybody can take a look at it. And in the pandemic plan, it's very clear that we ought not to be isolating the healthy. We ought not to be wearing masks. These non-pharmaceutical interventions are not to be used in a pandemic. That's according to the WHO plan that all Western countries signed on to in October of 2019. In February, March, we threw the plan out and we embraced a policy that was promoted by the Communist Chinese Party as being the most effective way of dealing with the virus. And of course, it was the establishment and the adoption of Communist Chinese Party authoritarian measures in Western liberal democracies. And for whatever reason, and I think there's many reasons. Michael Sanger and many other people have established this. Governor Ron DeSantis in Florida now is speaking about it, about how the Communist Chinese Party provided misinformation, manipulated academic institutions, corporate uh, North America, and provided outright false information. Many people may remember the videos of people falling over dead in Wuhan. Now,
Hmm.
that's never, ever been seen anywhere in the Western world. Um, but but the Communist Chinese Party released those videos that purposely scared an already frightened Western world, and um, and same with things like the um, where they encouraged Western medicine to use mechanical ventilators on people with COVID, which has historically always been known to be a most invasive and seldom successful medical intervention. It took a few months before Western countries said, "Oh, that was a real bad thing to do because that just killed everybody who came in with COVID." We've also have rejected, and we still to this day in much of the Western world, we adopted the communist Chinese propaganda that there was no treatment for coronavirus. This was going to be the first virus ever known to mankind, but there is no treatment. Um, and of course, we've come to learn that there's a vast number of treatments: ivermectin, hydroxychloroquine, vitamin D, and even the professor and doctor Peter McCullough made a testimony at the Texas state legislature a week or two ago, and he has stated categorically that there probably would have been 85% fewer fatalities in the United States had they used these known treatments like hydroxychloroquine and ivermectin, and and just the basics of zinc and vitamin D. So there's been a lot of manipulation. Um, I was glad to see this week that Governor DeSantis has actually come out and publicly stated that um, China, the Communist Chinese Party, uh, manipulated information to destabilize Western economies, and they've done a very good job at it.
It has been very successful so far.
Yeah.
We're in quite a mess now, economically.
Mm-hmm. Oh, it's just like if we can stop this path towards totalitarianism, and I'm not certain if we can, uh, but if we can, it's still going to be an outrageously um, diminished standard of living in the Western world, a significant increase in debt, significant increases in taxation, much less unemployment. Many businesses have been destroyed. Um, so it's going to take us a while to get back to where we were, even if we decided to do so today.
Hmm. And so, what would you say that you are in charge of Canada? What would be your game plan right now to kind of get us back on track and to get everyone?
Well, look at the evidence. We know that greater than 96% of all the deaths are seniors with significant pre existing illnesses. On average, at least 2.5 pre existing comorbidities. We know that over 70% of all deaths have been in long term care. We know that the average age of death in Canada exceeds our life expectancy. Our life expectancy is 82. The average age of death with COVID is 84. So that's the evidence It's not a projection. It's not a model. It's not a simulation. That's what has happened in the last 13 months. And there's only one solution. Recognize it as a seasonal respiratory virus that places people in those conditions at a serious risk. Open up the economy, take off these absolutely outrageous mandatory masks and social distancing, and closed borders, and reestablish a free society where individual freedom and individual responsibility is at its core. And then there's a great many things that can be done in long-term care. And Lieutenant Colonel David Redmond has put out a substantial package of recommendations that can be done in long-term care to alleviate or to mitigate some of that risk. You're not going to mitigate it all. When people are very elderly and very frail and near death, it often doesn't take much to, sometimes it only takes a feather to end, to push them that far. So, but there are things that can be done. And I would say, Lieutenant Colonel David Redmond's package illustrates a number of those things. But otherwise, recognize that we've been played by the Communist Chinese Party, and this is not the apocalypse that it was made out to be. Return to freedom.
And I saw that video where everyone was collapsing in the streets, and I was just immediately like, yeah, that's a fake video. But then I didn't know. I just thought it was someone made that video. I didn't know that like China put that out. I thought that was just a random video that someone made just as not as a joke, but probably to instill fear.
Yeah, no, this was all. So, Mike, take a look at Michael P. Senger's document that was released January 10th of this year, and it's called "The Communist Chinese Party's Global Lockdown Fraud." I'm a co-author of that study, along with General Robert Spalding and quite a number of individuals from around the world. It goes through this in quite significant detail and fully cited and sourced. And just to give you an indication, I sent that document to each of our provincial premiers, each of our leaders of the opposition in each province in Canada, as well as Justin Trudeau and Erin O'Toole. And I sent that on January 22nd, that document, and you can see it on my website, the full documents there. I have yet to hear back from any of our intelligence agencies. I've yet to hear back from any elected member in any of the legislatures or the House of Commons about what this document has to say. And like I said, it exposes a great deal. Nobody, it seems like we're fearful of being honest in Canada today.
Yeah, and that's one of the things that I've seen that's kind of weirded me out is Roman Baber, I believe you pronounce his last name, Roman Baber. He released that open letter and then immediately got taken out of the PC caucus, and they didn't address what he said, which was all very reasonable, And then the chief medical officer, like the old one from the 90s, who served as the chief medical officer, he said, I pretty much agree with everything Roman said. A lot of the metrics that you're using, I can't see any reason to use these metrics except for to instill fear. Like a lot of this stuff, it just doesn't make any sense. And they didn't address that either, So that's kind of where people started being like, all right, not only are these like very fair points, but then the government's also completely ignoring them. So it's like, why are they ignoring all these?
Well, so that's Dr. Richard Shabazz referring to, the former chief medical officer of health in Ontario. He first spoke against lockdowns in April of 2020. And he was ridiculed by the public health establishment and the politicians. Same with Dr. Lawrence Rosenberg, the chief medical officer of health for Montreal. Same thing happened to him. You know, the same thing is happening at all levels, whether it's political, academic, medical. Anybody who dissents is automatically scorned, ridiculed, and marginalized for not conforming to the dogma, not conforming to the narrative. And, you know, with Roman and Belinda, they were removed from caucus. Others are placed under investigation. I can't begin to tell you how many thousands of doctors, nurses, police officers, etc., who know that this is a falsehood, but are fearful of speaking out for that to be placed under investigation. We have a number of doctors, Dr. Kovinder Kaur, Dr. Patrick Phillips, Dr. Stephen Malthouse, just to name a few, who are under significant investigation by their colleges of the College of Physicians and Surgeons because they have spoken out. So there is a very significant coercive and intimidating element within our society to not be truthful, to not be honest, or there's going to be consequences. So that's, you know, you can look at why that is, and why is a very different question from what is happening and how it's happening. But I think, and that's a very deep question. It's not one that can be answered quickly. But I'll say this: there's a great many people, organizations, entities, and corporations that are significantly profiting from COVID, right? And that includes mainstream media. It includes big pharma, big tech, you know, and the political apparatuses. So that all see a benefit to themselves accruing, and will use whatever measures to prevent dissent from being.
Mm-hmm. And you got quite a bit of heat as well for comparing the Third Reich and the Third Wave together on Twitter.
I think it's an appropriate analogy, Jeffrey.
Mm-hmm.
You know, the Nazism was a conformity was its highest virtue. You know, and the image that I put out there showed the level of conformity that was in play. And you have to remember, Nazism didn't happen overnight. It took some period of time, you know, from the late 20s and early 30s through to its eventual Holocaust. But there was many steps along the way of obedience and conformity, and a lot of people don't realize this portion of the analogy. Much of the policies of Nazism were based on public health. You know, their public health system were the ones who established the eugenics program, and they're the ones who suggested that other races and other people were unclean and were a danger to society. And there was a very significant restriction in academia that prevented people from speaking out about these things. So there's a great deal of similarities, in my view, between now many of my detractors thought they were disingenuous in saying that I was equating the Holocaust to today. That's not what I said.
Mhm.
And it's not what the image portrayed. It was the many, many steps of conformity and obedience that I was making the analogy with.
No, that's perfect. I wanted to give you that chance to explain that because yeah, I did see a lot of comments saying like Holocaust and lockdown not the same thing at all. But I did actually just finish this book called Rise and Fall of the Third Reich, which is like 70-hour audiobook or something. And it
Yeah.
was yeah, like I can see and I noticed like with the censorship of the media and the way they're kind of controlling the narratives, like for example that girl who came, I think it was in Washington, and she said hydroxychloroquine and zinc
Yeah.
fixes this, and then they just got rid of her from the internet. Like she's just gone now, and like the controlling of information, stuff like that. I was seeing that as they were sort of explaining Joseph Goebbels and his like propaganda machine and how that worked and how they were controlling information and made it so that no other source of information was available to the German people except for the Nazi journalism, which made it seem to all of the Germans that like pretty much all of Europe was attacking Nazi Germany, and it wasn't that Hitler was kind of reaching out and trying to attack other people, right?
Yeah, there was only one narrative allowed. No, there was no competing narrative, and that's what we're seeing here in Canada. We have the censorship of the mainstream media. That's clear. There is the deplatforming and censorship on the social media. I was even banned from LinkedIn. Like whoever gets banned from LinkedIn, I've been suspended multiple times from Twitter and Facebook, and but then the greater censorship is our self censorship. There are millions of people in this province alone that I am clearly, I can say, oppose these measures, but are reluctant or fearful to speak truthfully about it because of their fear of being marginalized um, and being attacked. Um, so that's all very much. And then we have the relentless propaganda every day from our political machine of cases, cases, cases. Our models show that hospitals are going to get overwhelmed. They never say our hospitals are overwhelmed. They always say our models show, our models predict. And of course, over 13 months, we can go back and say, well, all your models are hooey. They've never
Mm-hmm.
come to pass. And nothing that you've done, whether it's mass or social distancing or lockdowns or business closures, the pattern of the seasonal respiratory virus has remained the same. We know every seasonal respiratory season begins in October, climbs up, and um, um, you know to a peak in January or February, somewhere in that neighborhood. Then there'll be a trough or a valley, and another peak in you know uh, March or April. That's how the respiratory season operates, and we've known that for hundreds of years. Um, and it's exactly that in Canada. So there's been no improvement, no spread, no difference in the spread with all these measures, but we have caused undue, significant, and tragic uh, consequences for a great many of other people who were never at risk. And I think the most appropriate term to describe this, when we look at the people who have died because of suicides and overdose deaths, and who the despair and the depression have driven them to these terrible outcomes, and the people who have died because they couldn't get organ transplants or cancer screenings. The most accurate term to describe that is we have committed social murder over the last 13 months in the Western world, especially in Canada. We knew that the consequences of the policies would lead to the early and unnatural death of a great many people. And our governments went ahead and did it anyway. They willfully decided that these deaths would be an acceptable collateral damage uh, during COVID.
Yeah, and I think it's important that yeah, I'm happy that you from the beginning have kind of put your foot down and said like this isn't going to happen. And are you seeing the movement of this getting bigger and bigger, like more and more people showing up to your rallies and things like that?
Oh yeah, there's clearly there's been a significant change in tide of people becoming more courageous, let's say, or um, more able to speak honestly. There's more people speaking that way, so that's a really good sign. That has to happen if we are going to get out of this. Um, but there's still many that are reluctant. There's still many who are fearful they will be lose their job or lose their paycheck if they speak out. But our rallies, our no more lockdown rallies, are gaining in both frequency and size. We're getting thousands of people out. We're this weekend, Jeffrey. We've got events in Ottawa, in Peterborough, Barrie, Orillia, Stratford, Chatham, Leamington. There's events happening throughout Ontario, and more elected people are also finding the wherewithal to speak out. So we started the End of Lockdown Caucus a couple months ago. We're now over 60 elected members who have joined up. This weekend in my events in Peterborough, in Stratford and Chatham, I'll be joined by Maxime Bernier and Derek Sloan at these events. And so, there is some optimism there, but we're not out of the woods yet. People in Canada have to wake up and realize, there's two paths before us, and one path leads to a complete totalitarian state, and the other path leads to what we have always known to be the most successful and most prosperous way for people to live, and that's with individual freedom, individual responsibility, and with faith.
Absolutely. And that's a good note to end it on, and I appreciate that. And yeah, so where can people learn more about you, and how can they kind of get involved in kind of spreading this message?
Well, come to nomorlockdowns.ca. We are distributing lawn signs. If you take a look on the wall behind me there, Jeffrey, you might see there's a No More Lockdowns lawn sign. We've distributed over 25,000 of those so far. We also have local volunteer groups who are organizing rallies, but also delivering postcards. We have postcards labeled Facts versus Fears to help inform people of the truth and not just the fear. And of course, we have other groups that we're putting up highway billboards across the province as well. So get involved, get engaged, join nomorlockdowns.ca, and help out in whatever capacity that you may be able to. If you can put a lawn sign, or if you can help out with the local volunteer groups, or if you can contribute financially to help pay for all this, however you can help out, we need to get us on that path towards individual freedom, responsibility, and faith quickly.
Excellent. All right. Well, yeah, we will. We'll get this up. Get it shared. See how many people can. Hopefully just kind of spread the message a little bit more. And this is something that, yeah, I think it's something that we have to keep talking about, even though it's something that, like, I'm sure you've spoken about it for a year now. You're probably bored. You don't really want to talk about it anymore, but it's something that, yeah, it's like, no matter what, if it's still a problem, we got to just keep hammering at it.
Well, I can't get bored with this. People need to understand, and this is an absolute truth. If we don't assert our freedoms, it is our children and it is our grandchildren who will bear the greatest consequence for our lack of action. Right? Um, you know, that is, we've seen this played out throughout history. Once a society starts going down a path towards totalitarianism, it gets very dark, it gets very bleak, um, and it lasts a long time. And uh, I, I think we all have an obligation to our children and grandchildren that they can live a free life and not live in a gulag based on our unfounded fears that we've adopted today.